Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, clinical features of Huntington's disease. Clinical features of Huntington disease. So, in the Huntington disease, main important clinical features are the disease. The Huntington disease mainly develops at the age group of around 4th to 5th decade. It develops at around 4th to 5th decade, and sometimes if there is issue of anticipation, in such cases the disease development is early. Otherwise, the disease in most of the cases it is from 4th to 5th decade, but it can occur from childhood till the age of to more than 75 years based on the anticipation effect. Here in the Huntington's disease, the main important thing is the progressive chorea is an important feature of Huntington's disease. The patient will also develop other features like emotional disturbance can be seen with dementia, and the patient may also lead this disease might also lead in the death of the patient. If you see the gait of the patient, it is actually poorly coordinated due to the chorea, and it is also of dancing quality. The patient will develop emotional disturbances may be seen, and these emotional disturbances may result in irritable behavior of the patient. The patient will have attention deficit, and there is attention deficit will be there in the patient, and there can be impairment of judgment is seen in the patient. There is lack of awareness of certain events may be seen, and there is also um, deficit or deficit in executive functions. Carrying out certain functions may not be proper, so there will be deficit in executive functions are seen in Huntington's disease. Similarly, the patient might have depression. He might have social withdrawal because of all these chorea like symptoms. He might have irritability because of behavioral symptoms, and disinhibitions are common in Huntington's disease. Then in Huntington's disease, if it occurs in juvenile cases, that is called as juvenile Huntington's disease. Here in juvenile Huntington's disease, seizures are common, whereas in adult Huntington's disease, actually the seizures are rare in adult Huntington's disease. Then, so if you were asked what is the triad in Huntington's disease, the triad in Huntington's disease is number one, there is chorea, which is called as decreased movement, there is defective mood, and there is defect in memory. So defective mood, defective memory, and disturbed movements are the disturbed movements, disturbed memory, and disturbed mood. This is the triad of the Huntington's disease, which can be remembered as 3M, which is the mnemonic. Then,
thank you and thank you for watching.